We have love for Africa. There is hope, hope in Africa. We are serving Africa. We are serving Africa. With all passion, we are serving Africa.
Welcome back to Serving Africa, where we are looking at the various challenges facing Africa and how these issues are being solved and improving the living conditions of millions living in Africa. With me here at the MTA International Studios in London are two distinguished gentlemen from Humanity First Organization, the Director of Programs, Fazal Ahmed, and one of the project managers, Issa Wema. Our main focus today is orphans of Africa. Growing up with one's parents in today's Africa is a challenge enough. Disease, hunger, wars, and natural disasters have made many become orphans in Africa.
There are no people more vulnerable in this world than orphans. Children that have been left without parents and are potentially without family, food, and shelter. Of the 140 million orphans globally, 52 million are found in Africa, and this is due to widespread disease, disasters, and war. Of these children that have lost one or both of their parents to AIDS, 80% are found in Africa. During the recent Ebola epidemic, 16,000 children in Africa lost their parents. And recent conflict in Mali has created 250,000 orphans. And with sub-Saharan Africa having the highest percentage of orphans trafficked, without care and help, millions of children are vulnerable and subject to a fate of forced labor, sexual exploitation, and even death.
Fazal Ahmed, Director of Programs, Humanity First. Orphans of Africa. How serious is this situation? Is it a crisis?
I don't know if it's a crisis. It's been an ongoing problem in many low-income regions, not just Africa. I suppose the one thing is that when we talk about orphans, often we've found that they still have grandparents, they still have uncles or aunts, they have other people who have an interest for them. But in labelling them as orphans and taking them away from their environment, that represents probably the gravest danger for them. And it's encouraging that in recent times we're starting to see orphan programs keeping orphans closer to the environment that they know.
Issa Wema, you are a project manager with Humanity First. What is the situation like on the grounds with regards to orphans?
Well, you asked whether it is a crisis. I would say it is a crisis because I'm maybe an alarmist. But when you look at it from a few years back, it wasn't happening. It wasn't like that.
So what has been the cause?
The cause is some of the things you mentioned: wars, famine, and so many other things. Wars which are not even from the local area, not from within the country. Wars which have been, if you like, dumped on them because people, again, we will talk about exploitation. This is what it is about. Wars that are being fought within the country because people from outside want the resources from that country.
So would you say that orphan care is one of the top priorities, major issues affecting Africa?
Yes, because these children, and you know, you talked about the numbers, the huge numbers that are orphaned in the continent. These children will be the adults of the future. They are the most vulnerable in society. They're the ones who are going to be trafficked if we don't take care of them. They're the ones who are going to be exploited in so many ways. And we've seen actually in trouble spots, we've been talking about warfare, often they take orphans, drug them, train them to become the killers of the future. So in safeguarding them, we we give them more hope and we give the continent more hope for the future.
Yes. In the world, we know that we have over 140 million orphans around the world. How come that Africa seems to have such a huge number, about 52 million by UNICEF report 2017? What are the major causes? Yes, there are wars happening all over the world, but how come Africa alone seems to have such a high number of orphans?
I think healthcare plays a big role. So when you see epidemics like cholera or in 2014 the Ebola crisis or HIV/AIDS, because in the provinces there isn't the same level of infrastructure for healthcare and prevention. There isn't even water and sanitation to the level that we would expect. There is in the cities, but not in the villages. Then when something like that passes through, when Ebola comes through, it has far, far greater impact than it would have, say, in Europe or in Asia. Far greater.
Would you say, Issa Wema, would you say culture has also played a role?
I don't know much about culture, but if you look at, listen to what Father Saab said before, if you watch what happened during the Ebola crisis, how many people died in Africa? How many died in Europe? How many died in America?
But there was no Ebola crisis in Europe.
Oh yes, but it did come to Europe. It did come to America as well. We know of situations where people came with Ebola, but it was contained within a very short time. How long did it take before even the first sort of medical staff went to Africa?
So what would you say are the issues? What was not right? What prevented them from containing it?
The response of the international community was very, very slow. If it happened anywhere else, it would have been swift. Like I said, when those who contracted, those nurses and so on, who contracted the disease and came back, it was very, very swiftly dealt with. The same response wasn't there for Africa. Not to talk of the fact that in Africa, we don't have the facilities anyway. So if any place needed the response to be swift from the international community, it was Africa.
So are you saying Africa lacks facilities at all, or we don't have adequate numbers?
Both.
Both. I'll come to you, Fazal Ahmed. So what is the Humanity First organization doing to help solve the orphan crisis in Africa?
So we'll probably discuss the orphanage in Benin later, but if you look at various parts of Africa, we're finding the issues facing orphans are education and healthcare predominantly. So after the Ebola crisis in Sierra Leone, in Guinea-Conakry, in Liberia, we've been looking after the education needs of these orphans. I visited some of the Ebola orphans in Mashaka, in Port Loko, even in Waterloo, about an hour outside of Freetown. And by helping them
So you've been on the grounds?
Oh, yeah. And by helping them with clothing, with education resources, and with access to healthcare. Many of the Ebola orphans, it was interesting, these children were the ones who, I can think of one child in Waterloo, out of 28 of her family members, only her and her grandmother survived. Only her and her grandmother. Her house, they burnt because they thought this whole house is now contaminated with Ebola. Her and her grandmother survived. A year later, she started to get eye problems. She's lost one eye. And this is not unique. Many of the Ebola orphans are struggling afterwards with eye problems.
So Humanity First does take care of their health.
We're working with site savers in Freetown, for example, and trying to provide them with eye screening and to try and identify problems early and give them, and other forms of healthcare as well, to try and give them the best chance to thrive.
Do you have anything to say about how Humanity First is helping solve the orphan crisis?
Oh yes, what Humanity First has done is unique. By taking these orphans into care, they are not just dumped in a big area, with everybody else. Within that big area, they've created families for them. So there is a mother for, say, every 5-6 children within the compound.
So you're saying in the Humanity First orphanage, they're not just there like in the school. every group of 5 or 6 people
have a mother who resides there with them in their compound. So if, say, one of them doesn't come back within a certain time from school, for example, there is a mother who will look for that child. There is a sister or a brother within the family who would ask, where is A or where is B?
So it's more like foster homes within the orphanage.
Within the orphanage. Yeah. So that is a unique way in which Humanity First is doing it.
And in terms of numbers, can we have an idea of the impact you have been making on the ground?
I mean, I would say it's hundreds. It's not thousands. You know, looking after orphans is an expensive business. You can either just give them, 2 beans, and that's that, and you can say we've given 1,000 orphans 2 beans each. But if you're going to do it properly, look after their education, their clothing, their welfare, then it's quite an expensive program. Where I would say we are fairly unique, Isa Wemasa rightly described the situation where we're creating virtual families. But the other thing is, look, when we say orphans is a very emotive term. It's even more emotive for Muslims because our Prophet ﷺ was an orphan. But when he was an orphan, he still had his grandfather to look after him. And after his grandfather, he had his uncle to look after him. He had cousins.
So close relations.
Close relations. And it's the same thing that we see in Africa. So if you see an orphan in Burkina Faso, they know that actually in Zorogu, I have my uncle and I have 5 cousins.
But equally, there are others who don't have a clue where they are from, especially those who are allegedly dumped by their parents without any sources. Do you also take care of those?
Of course. Nobody is without a clue with regard to their relations or something. Humanity First makes sure that they have a relation somewhere who knows about them and who visits and whom they may visit from time to time. So that family relationship has to be there. It's always there.
And in the case of Ebola, for example, there were many situations where the child was orphaned and the child would have been taken away to some other region or even to Europe or America. However, when we inquired from the families, Port Loko, there were thousands, hundreds, if not thousands of Ebola orphans in Port Loko area. When we inquired, we found that actually this child, their grandmother is there. This is the grandmother.
Right.
The reason she's not coming forward is she can't cope herself.
Financially.
So what we did was we said, if you're an uncle or your grandmother or whatever it is, if you are prepared to look after the welfare of this orphan who is from your extended family, we will provide you additional resources for your other children. We will provide you with food. We will provide you with, in the case of Ebola, we provided extended families with infection control, sheeting, cleaning materials, so that the whole family felt safe. And actually they felt safe that this child who was in the Hastings Treatment Centre and survived Ebola, we're worried that they would still have Ebola. But actually, you've given us the resources, we will look after them.
So these ladies, I'm interested to know, who look after the children within the orphanage, so to say foster mothers within the orphanage, do you normally get some of these relations, or they are entirely independent people who volunteer or work for Humanity First?
They tend to be independent. They're trained women, they are independent, but they have within them a spirit that I want to look after these children as if they were my own.
Yeah.
And women in Africa are amazing and amazingly resilient. We saw it after the genocide in Rwanda. There were so many children orphaned after that terrible crisis there, and yet women came forward and looked after hundreds of orphans, and they didn't discriminate. They treated each child as if it was their own. And that is a phenomenal. It's an attribute. It's not a skill. It's an attribute which these women have.
And it is natural in the African communities. You just have to go somewhere in an area and see children together and say they want to hurt each other, and there's a woman passing by. Naturally, she goes and she takes them and she treats them like her own and disciplines them and looks after them until maybe their parents come. It's natural.
A very, very good comment in appreciation of women in terms of caring for all of us. Now we do have a caller from Benin, Mr. Fahim Difintala, who is looking after one of the Humanity First orphanages, the Darul Akram Benin Orphanage. Hello, sir.
Yes, good evening. Hello. Salam alaikum.
Wa alaikum salam. May the peace and blessings of Allah be upon you. How are you doing in Benin?
Alhamdulillah, alhamdulillah. We are doing fine. What I'm hearing in the conversation, here there is the first orphanage of Humanity First on the whole world. So it is a very special occasion to build an orphanage here in Benin. And the system, what we are following over here, is structured by the government. So we are only taking the orphans from the social bureaus of the government. We cannot take anyone just from the street because it is all registered. And we take the birth certificate, the report.
Could you tell us, Mr. Fahim, how this orphanage came about?
Sorry again, please.
Could you tell us how the Darul Akram Benin Orphanage started?
Yes, the name is Ahmadiyya Darul Ikram. The name is given by Hasur himself, alhamdulillah. We started here in 2011. And it was all
2011.
The municipality gave us a plot of land of 1.5 hectares to build the plan which was bought, which was given from Germany, Humanity First Germany, and like that we proceeded. And after 2 years, it was finished. So that is just briefly how we started.
What would you say are some of the facilities you have at your orphanage to help solve this orphan crisis in Benin?
A very nice opportunity here is our school just on the overside of the orphanage. It is a private school, and the level of the school compared with the public schools is a bit better. They have no strikes, and it is very, very nearby. So the children just go to school and come back. That is one thing. On the other hand, we have such a big plot of land that we are planning for the next year to build our own school on the place, and that will give us a very much chance to take also the children from the neighborhood in our custody.
When you say children, what sort of ages are we talking about? Do you have in the orphanage?
By the grace of God, we have now 11 children, alhamdulillah. And we are growing. We are planning to finish end of the year to about 24.
Thank you very much. Any particular stories of interest of any child that strikes a chord to you that you may want to share with us?
Yes. There was a special case over here. Once there came a father with a child on the port, and this child was just born, and the mother died at the time of delivery, which happens often here in Benin, because the medical care is not that high standard. But anyhow, he came at the door, and it was such a miserable situation. The baby was Zakaria. His name is Zakaria. And while the mother passed away, the father didn't know how to carry on, and we were given this just in the hands like this. And if you see such a small baby, so helpless, you cannot send him away and no, we have to follow, we have to find first your papers. No. We first took the baby, and 1 or 2 days later on, we finalized everything with the government bureau. And a week later, the 2 sisters of this little boy came when they were crying, when entering here, they were crying for 3 days. Really, 3 days, crying. They were so desperate. Mother has passed away, and they were just left behind. So, but after a week, you can say, gradually, it was getting better and better, and it is very nice to see also, how you say, amazing, how you see that the other children, they're taking up the sadness of the others, and they start playing with them and teaching them how we do over here. And after some time, it was, if you see them now coming from the school, they are running to our house, and they're having a very good feeling of safety and getting much family warmth. And this is what we are for, to give them a very nice feeling and give them good education at the school, give them good food so they can survive and they can have a good future in their life, inshallah.
In terms of safety,
Yes.
he hasn't told you, but Mr. Fahim is also an expert snake catcher. And I'm sure he can.
I understand, Mr. Fahim, you are an expert snake catcher. That brings us into safety. How do you ensure that these children in your care are safe?
Yes, because the caretakers, the security is keeping the surrounding clean and sound, and like this, they find easily the snakes if they are snakes. But snakes still can enter and coming over the wall. But it is not a big deal. The snakes, they are very easy to catch, and the security, they walk every hour, they make a round, and the children, they play in front of the house where there are no bushes and there is no place for snakes, you can say. So there's not a big harm, and they don't go behind where there is no security. So we are looking well after them, alhamdulillah.
Very good to know that the children in your care are in safe hands. But I would like to know, sir, how do you admit children? Is everybody admitted, or you go and select a particular group of people? How is your admission process?
Okay. Yes. Thank God we are from the Ahmadiyya community, which means that we take any orphan, whether Christian, from the animist, or anyone who is orphan, we will be called by the government bureau, social bureau, and they will ask us whether there is an orphan, and they will ask us if we can take care of him, and they introduce the case, and we see how we can manage. In the beginning, we could not. We were a bit afraid to take babies as well, but at a certain moment, when a baby comes at the door, you cannot refuse. So we were brave enough to accept also the babies, and Allah helped us a lot. Since then, we also accept the babies, but always it goes through the governmental bureau, the Bureau of Social Service.
Thank you very much, Fahim Difentala, who is in charge of the Humanity First Benin Orphanage. We are grateful for your calling in into this program. We come back to the studios. What do you have to say about the submissions of Fahim?
Well, I was going to ask him another question, but
he's off the line now.
I think to start with, the fact that there is no discrimination between people from different religions or whatever background itself is very laudable, and we are very grateful for that. I was also trying to find out how they they keep, if you like, child abusers from these children?
In fact, that is a question I want to ask Humanity First. But let me ask the Director for Programs about your orphanages and the orphan care in general, how you tend to secure these children from traffickers and other abuses that we hear of from other orphanages.
You know, Humanity First is just one of many NGOs working in the continent. SOS shelters have done a hell of a lot of good work. And one thing I've noticed over the last 10, 15 years in Africa is that in the early days, orphanages were a lot more open. So if you said, I want to visit the orphans, you could visit, you could take photos, you could take them some toys, you could go at any time. Now, I had two examples in the last 2 years. One was in Yundum in Gambia, and one was in Bouaké in Ivory Coast. And in each case, we had taken resources for orphans. We got to the gate, and these are gated, walled, secure places. We rang the bell, we knocked on the door. Lady came to the door and said, "Who are you?" We explained, and they said, "Do you have a prior appointment? Do you have an authorization letter?" So it means that they are taking security very seriously. And we had the local mayor with us in Gambia who said, "I am the mayor, I'm saying to you, let them in." She said, "No, these are my children. Without proper process, they will not be allowed in." And I was so pleased to hear that. That was the first thing. Secondly, when you do go inside, so in Bouaké, we had arranged beforehand, we went in, we took clothing and other resources for the orphans, we took books for their library, we took toys for them. And before we went to that stage, the madam of the orphanage came to us and said, "By the way, I hope you're not offended, but we do not allow photos with our orphans for their own safety." Right. And this is fantastic. This shows you that awareness is coming into Africa, that safeguarding these children requires many facets. It requires perimeter security. It requires, nowadays, people can use their phone and take photos. And if you were talking about traffickers, that's how they find out which children are in there. By stopping photos and by keeping perimeter security, you give more chance to securing and safeguarding those children.
But an interesting point that came from discussion with Fahim, who is in Benin at the moment, taking care of the orphanage there, was the maternal mortality rate going very high. What is Humanity First doing to help in reducing maternal mortality rate in order to curb the numbers?
So the number one factor affecting maternal mortality and also neonatal and pediatric mortality, under 5 mortality, is water and hygiene and sanitation. So women who are born in hospitals, if you were born in Kolebu, chances are you'll be fine. If you were born in an outreach medical clinic north of Yendi, you're going to struggle. And it's because if you don't have, you might have a nice bed, but if there's no water and sanitation, then there's more chance of infection. Same with the children.
That's all time will permit us. But can you say a word in relations, one each, with taking care of orphans and your belief as Muslims?
Our Holy Prophet Sallallahu Alaihi Wasallam was an orphan. And if that doesn't inspire you to do more for orphans and to have compassion for orphans, nothing more.
Well, to add on to that, what the Holy Prophet himself said about looking after orphans and what the Quran says about it is something for everybody to want to do something for orphans. So that's why I think I'm saying that it is going to increase. A lot of things will have to happen from Humanity First and members of Humanity First to support these orphanages throughout the continent.
And even, it's not just directly in the orphanages. Our sewing training centres, like in Uganda, in Budaka, we're making uniforms for orphans, giving them free clothing and uniforms. So there's many ways we can help.
Thank you very much, gentlemen, for joining us on 7 Africa. With me to discuss Orphans of Africa has been the Director of Programs for Humanity First, Fazal Ahmed, and a Project Manager for Humanity First, Isa Ahmed Wema. We have been looking at how Humanity First has been helping provide facilities and amenities to take care of orphans in Africa. Thank you for joining us, and we hope to see you on another series of 7 Africa.
We have love for Africa. There is hope in Africa. We are serving Africa. We are serving Africa. With all passion, we are serving Africa.